Welcome to this module on interoperability, privacy, and security. Interoperability is defined as the ability of health information systems to work together within and across organizational boundaries in order to advance the effective delivery of healthcare for individuals and communities. Interoperability is one of the federal health IT goals from the 2015 to 2020 strategic plan. Along with the goal of interoperability, there are federal health IT goals for privacy and security. The importance of protecting health information, or PHI, has become even more important as the use of mobile devices, sensors, personal health records, telehealth, and health information exchanges has increased. Privacy is the right of individuals to control access to their personal information about themselves. The laws, known as HIPAA or the Health Insurance Portability and Accountability Act, began in 1996 and have been revised several times. It's important to realize that HIPAA doesn't cover all privacy rights, only the rights as they relate to protected health information. The 2009 edition included requirements for privacy breaches by covered entities, such as hospitals or its business associates, such as external billing services. When a breach affects more than 500 residents, the covered entity or business associate is required to provide notice to media as well as to the individuals. In January 2013, there was another update. Individual clients can ask for a copy of their electronic medical record, and there are new limits on how information is used and disclosed for marketing and fundraising purposes. PHI can be used for the secondary use of health data, such as public health monitoring and research. On the other hand, HIPAA security rules require safeguards to be in place by organizations to ensure the confidentiality, integrity, and availability of PHI. Organizations must maintain a high level of the public's trust. Breaches of privacy and security undermine a patient's confidence in the healthcare organization to protect their information. The federal government has helped organizations to understand and manage cybersecurity risks by establishing the National Institute of Standards and Technology and the Computer Security Resource Center within NIST. Another aspect of security is risk management, awareness of the current types of cyber threats, and the latest defensive measures to combat these threats. Current security vulnerabilities are classified into types: natural events such as floods or hurricanes, or external events such as hacking and installing malicious code. Another area for vulnerability is in cloud-based services, such as personal health records and fitness trackers, and even cloud-based EHRs. Ransomware has emerged as a new threat targeting the security of healthcare data. Medical devices are also a security concern because they are used for monitoring patients and surgical procedures. Many devices have the capability to connect and share data through a network and thus make it susceptible to hackers. Another area of vulnerability is internal sources. Prior to 2015, most security events were from internal sources, either unintentional or intentional. The most important prevention is to conduct a risk assessment. There are a number of toolkits from different organizations that are available. An advanced practice nurse should definitely be aware of safeguards in place and the policies and procedures to prevent and detect violations of security.